Hello and welcome to our presentation on mapping and diagnosing mental health in the UK university sector. My name is Dimitra Kotouza and I am a researcher in the project based at the University of Lincoln. The primary investigator is Dr. Leon Rocha, also based at Lincoln, and there are two co-investigators who are also here, Professor Felicity Collard, based at the University of Glasgow, and Dr. Philip Garnett, based at the University of York. Our project is funded by the Wellcome Trust. This research project is inspired by the fact that in recent years we have seen enormous changes in the UK university sector. Tuition fees have risen to over £9,000 per year. Higher education is ever more relentlessly subjected to metrics, and many institutions have expanded rapidly through unprecedented levels of borrowing. At the same time, the mental health and well-being of students and staff are said to have deteriorated. In response to this, universities have sought to address the problem of student and staff mental health in a variety of ways, and our project seeks to produce the first systems and network analysis of actors and organizations that influence policy on mental health in higher education. Our project brings together network analysis with the qualitative analysis of policy texts and grey literature that are related to our question. We map the charities, think tanks, lobby groups, regulators and other organizations that are linked to the higher education sector. We build our network using a Neo4j database, which is a NoSQL network database. It differs from traditional relational databases in that it stores information as objects, called nodes, and the relationships between those objects, called edges. The resulting map can be analyzed as a network, allowing us to identify key influences as well as key communities that are highly connected. The qualitative analysis then provides more detailed information around the different nodes and what their common purpose of activity might be. There is a feedback loop between the qualitative analysis and the network analysis. One part of the research guides the other. In this presentation, I will begin by outlining some broader historical developments that are related to mental health and well-being policy in the United Kingdom, which then came to be related to how UK universities address the question of mental health. As I outline these trends, I will be showing you how they are reflected in the network mapping that we are carrying out. You will also notice that the presentation concerns more the mental health of students than that of staff, and this is because university management is more interested in the former than the latter. Even though the mental health of students in the UK was an issue that concerned university management since the 60s, there has been more interest in it in recent years, and this interest seems to have a different policy logic than it had in the 1960s. A renewed interest in mental health and well-being emerged under the governments of the Labour Party between 1997 and 2010. A key figure and influential node was Richard Layard from the LSE Centre for Economic Performance. He raised mental health as an economic issue in terms of hours of work lost from the economy and in terms of the cost to the state through benefits for sickness and mental ill health. He pushed for greater state investment in so-called evidence-based therapies, such as CBT, cognitive behavioral therapy, and for preventative approaches focused on building resilience, not only among workers, but especially among young people. These programs began around 2003, and they have continued to be a key preventative policy. The discourse of resilience and of positive mental health as a skill to be learned is drawn from positive psychology, which is the therapeutic model favoured by Layard. In collaboration with other key New Labour figures linked with the think tanks Demos, the New Economics Foundation and the Young Foundation, Layard co-founded the charity Action for Happiness, which promotes positive psychology in all areas of life, but especially in primary schools. A second strand of policy that gained strength in New Labour years, and which continues to be influential, is associated with behavioural economics, and it is the Behavioural Insights Unit also known as the nudge unit. To put it briefly, based on behaviorist theory, the unit has sought to devise cheap and simple solutions to complex problems. For example, in the area of mental health and well-being, they promoted interventions such as email campaigns. The influence of this approach is evident in current interventions that use messaging apps to improve student well-being and mental health in university campuses. During the Conservative and Liberal Democrat coalition government between 2010 and 2016, these trends continued, and the same networks continued to have influence, but they came to also involve charities and private sector providers of mental health care and well-being programs. By 2016, Mind was commissioned by the Conservative government and NHS England to produce reports for NHS mental health service restructuring and on well-being at work. These reports put emphasis on innovation, data, and again, resilience. At the same time, health science networks were set up to facilitate partnerships for this innovation among NHS, universities, and private and charity external providers. This coincided with the introduction of the so-called Teaching Excellence Framework, which is a government assessment of teaching quality at universities. The criteria of this assessment is not based on teaching observations, but only on outcomes, the outcomes of student progression, student employability, and student satisfaction, which is measured in the annual National Student Survey. In this way, the Teaching Excellence Framework puts pressure on university management to deliver interventions that are aimed at the individual labour market performance of graduates. Universities UK is an organisation that claims to be the voice of UK universities. Effectively, it is the University Employers Lobby Group. In 2017, Universities UK commissioned a report by the think tank Institute of Public Policy Research on student mental health. The report concludes that the higher education sector should treat student mental health as a priority. Thus, student mental health emerges as a problem in the discourse of university governance alongside the problems of enhancing student satisfaction and employability. Universities UK has released a series of policy texts with the slogans and social media hashtags of Steps Change and Whole University Approach. These documents put an emphasis on leadership, co-production, information, inclusivity, and research and innovation. These keywords also aligned with the criteria of the Office for Students, which is the higher education regulator in England. The Office for Students in 2019 launched a competition to fund mental health projects in universities. The characteristics of the programs that were awarded funding indicate the type of mental health interventions being advocated by the government. First, they promote well-being, self-agency, resilience, and independence by including mental health in the university curriculum. Second, they form partnerships with mental health charities, private providers, other universities, and the NHS. Third, charities and private companies, for example, Papyrus, the Charlie Waller Memorial Trust, Mind, FICA, Enlighten, and UniHealth. These companies provide consultancy, training, digital applications, dashboard platforms, and services. Their aims are student resilience, engagement, progression, employability, and suicide prevention. Fourth, the co-production of interventions with students takes the form of sometimes unpaid student labour, such as volunteering, for example in the Nightline Crisis Support Service. And second, companies run online surveys or collect usage data to analyse and target specific groups of students. Fifth, these projects form partnerships with the NHS, whereby charities provide counselling and well-being support to students. The grand picture is one of the creation of multiple opportunities for new providers, often with the explicit aim of improving a university's scoring in the Teaching Excellence Framework. One of the projects that won funding in the Office for Students competition was a project by University of Lincoln called Transitioning Students Effectively. This project involved a new contract with the company FICA Community, which is the provider of the mental health smartphone app FICA. The rest of our presentation will now concentrate on FICA, which has become increasingly prominent in the UK higher education sector. FICA Community is a tech startup company that was founded in 2018 and now claims to have established partnerships with 55 UK organisations, including University of Exeter, Manchester Metropolitan University, Middlesex University, and the University of Lincoln. FICA calls itself a customizable mental health platform, and it uses positive and sports psychology to present itself as a mental fitness app. Users, quote, exercise their emotional resilience skills. Its content consists of 5-minute so-called workouts that involve watching a video of another student or well-known athlete saying how they confronted stress, perfectionism, low mood, failure, or lack of concentration. And as is the case with positive psychology in all of its modalities, and in explicit contrast to analytic and psychodynamic approaches, there is an emphasis on training for resilience and positivity and avoiding overthinking. Instead, there is a focus on taking action, which overlaps with coaching and the world of sports. This is in line with the preventative educational approach promoted by the aforementioned policy networks in Universities UK. FICA presents its workouts as a form of emotional education that should be incorporated in the university curriculum. And in response to the concerns by university management, it markets its product as enhancing student performance and employability, which would feed into universities' teaching excellence framework scores. FICA's offer is also in line with the parallel process of cuts to mental health provisions at many universities. They argue against what they call medicalization, claiming that providing mental health services to masses of students complaining of anxiety then deprives those with serious conditions of the resources. FICA takes up the Office for Students policy target of co-production by involving students in its videos, evaluations, and marketing. In this case, co-production seems likely to mean unpaid labour. At the moment, it's unclear how students are approached to participate in the process. In terms of evaluation, FICA evaluates the effectiveness of the app through partnerships set up between their own research team and university psychology departments such as those of Lincoln and Middlesex. FICA also funds a PhD supervised by FICA's head of psychology, involving a 1-year placement at FICA followed by a 3-year studentship. Now for some conclusions. While we're still in the process of mapping the entire picture of the research, a pattern appears to be emerging. First, what comes to count as valid knowledge, prioritized for policymaking, consistently avoids the question of causes and contributing factors to mental ill health in UK higher education. This is linked with the favouring of positive psychology approaches in key policy networks. It is thus no surprise there is increased funding for research to demonstrate the effectiveness of well-being interventions, so-called resilience training, and for minor behavioural nudges or environmental tweaks. Positive psychology approaches directly criticize the search for underlying causes, whether they pertain to personal histories or social conditions. It aims to empower individuals to rise above obstacles and past histories. Similarly, behavioural and environmental interventions are driven by the aim to achieve maximum outcomes with minimum financial investment. It is also notable that the expertise of existing mental health support and counselling professionals in higher education is conspicuously absent. The discourse of technological innovation functions to render existing know-how outdated. Second, it's becoming clearer that the focus on university mental health since 2016 coincides with the introduction of the Teaching Excellence Framework. The coincidence between the interest in mental health and the metricization of degree progression, employability, and course ratings are particularly evident when one analyses the marketing literature of charity and private mental health product vendors that are entering the UK higher education sector. Finally, it is also evident that the crisis in university mental health has almost instantly created a new and buoyant market for these vendors. This is part of the broader transformation in UK mental health policy, which focuses on prevention and early interventions, which are ideally tech-based and target the young population, an approach linked to the aim of a resilient workforce that is less likely to create costs for employers and the state, while simultaneously removing conventional medical support and welfare provisions through austerity cuts. So these findings and conclusions reflect the status of our research on mapping and diagnosing mental health in the UK university sector at the moment. We will be very grateful for any feedback and questions that you can go on and ask us now. Thank you very much.